case Conant versus Walters was a lawsuit that was filed by doctors and severely ill patients after the U.S. government started threatening doctors with the loss of their license if they recommended the use of marijuana in their medical treatment. Since marijuana is classified as a Schedule I drug, which is in the same category as LSD, ecstasy, and heroin, proper clinical trials can't be done until it is downgraded to the same standards as other medications. Some of the ethical issues that accompany this case were the physicians being threatened with the loss of their license by the U.S. government, which led them to not be able to adequately care for their patients, and the trust that got compromised between the patient and doctor's relationship when the physician had to censor and curtail the medical advice to save their license. Cannabis has been proven to be effective for patients suffering from HIV/AIDS, glaucoma, cancer, depression, PTSD, anxiety, and those are just what was found without the ability to do proper scientific research. In some patients, the aggressive medication, chemotherapy, and other treatments that they experience can produce nausea, vomiting, weight loss, chronic pain, sensory impairment, exhaustion, and other symptoms that sometimes seem unbearable. But with cannabis, it helps decrease the suffering that some of these patients have to go through, making each day a bit more bearable. Marijuana has been associated with a negative stigma for years that scares individuals into thinking that it's a terrible drug that shouldn't ever be used. Government officials say it was made illegal for multiple reasons. The negative correlation that officials like to stress is that smoking marijuana can cause damage to your lung tissue. While it is true, that doesn't automatically make marijuana a terrible substance. Smoking anything will cause damage to your lungs. Other ways you can consume cannabis without smoking it are by eating it or using ingestible oils. Ingestible oils are cannabis concentrate that commonly comes in capsules that can be taken orally or added to your meal or beverage. The courts have deemed marijuana illegal but have kept far worse drugs on the market like lispronol, which may cause liver damage and liver failure. Marijuana's negative correlation does not outweigh the good it can provide, mostly because the side effects they stress so much can easily be avoided. When a doctor prescribes a drug, it's in the best interest of the patient's case. Due to the fact that those court officials aren't in the rooms with the patient themselves and do not fully understand what each individual is going through, they should not have a say in what a doctor can and cannot prescribe. A doctor who goes through years of medical school is clearly far more qualified than a court official who's been subjected to law school and does not know much about the human body. So everyone is different, and some people say that marijuana isn't for them, but to say that now it should be illegal because some people don't react as well is absurd. Because that's like saying that just because some people are lactose intolerant that we should now ban all dairy products just to benefit those who don't react as well to dairy. That's not fair to people who use dairy every day. But to recap the case, Conant versus Walters occurred after the U.S. government threatened doctors with the loss of their license if they recommended marijuana to their patients. The lawsuit was filed by physicians and patients, and the district found it in favor of the physicians. A permanent injunction was then issued, which now permits physicians to discuss marijuana with their patients and to approve the use of marijuana in their medical treatment. A utilitarian would agree with me when I say that marijuana should be legalized because it would maximize happiness for all those involved. Marijuana is banned on a federal level, so along with allowing proper research, legalizing marijuana would stop individuals from getting arrested on a daily basis because of their recreational use of cannabis. Therefore, legalizing marijuana would have a positive effect for everyone involved.